Good afternoon, everyone. I'm Tanya Bamford, Chairwoman of the Montgomery Township Board of Supervisors. On behalf of my fellow board members and staff, I'd like to welcome you all to our first live streamed town hall. The purpose of this virtual event is to share relevant news related to the COVID-19 pandemic and details on our phased reopening. I am very excited to share that our guest today is none other than Dr. Valerie Arkoosh, Chairwoman of the Montgomery County Board of Commissioners. Montgomery County has been recognized in the local, regional, and national news for sharing regular and very detailed updates on the spread and impact of the novel coronavirus across our county. These efforts have contributed to the flattening of the curve and our gradual reopening. We are delighted that Dr. Arkoosh could join us today. Before we get started, as a matter of housekeeping, I just wanted to let our viewers know that questions can be submitted for our guest using the chat feature on the right-hand side of your screen. Please be sure to submit your name and address along with your question. We have about an hour of Dr. Arkoosh's time today for this, and we do have some planned questions, so time permitting, we'll be taking your questions at the end of my Q&A session with Dr. Arkoosh. So without further ado, we're going to go ahead and get things started. And welcome, Commissioner Arkoosh.
Thank you so much. It's really a pleasure to be here.
We're so happy you can join us today. Maybe we could start with an update on how things are looking in the county.
Well, thanks to everybody's hard work and an awful lot of personal sacrifice over the last 12 and a half weeks, things are looking very good. We intend to move into the yellow phase on Friday, and I can talk in more detail about that later on, about what that means and what kind of infrastructure we put in place to make sure that that's a safe transition. But by and large, we are absolutely moving in the right direction, which is exciting.
That is very exciting. I know here in Montgomery Township, we've had about 200 positive cases and unfortunately 28 deaths, I believe, to date. Not looking for an update from you on those numbers. Maybe you could give us a preview if there's any jump. I'm just saying, throwing it out there.
Yeah, I can tell you where we are for the county. I'm sorry, I didn't check the township numbers this morning. But since yesterday, we had 97 new cases of COVID-19 reported across the county. So that brings us to 7,221 since this began. And those are all virus tests. We don't report any positive antibody tests. Antibody tests are like looking in the rearview mirror. They tell you if you had COVID-19, but they don't tell you if you have it today. So we only report on virus tests. And that's a lot of cases in 12 and a half weeks. Most of those cases today are from the community, 88 of them, and 9 of them are from long-term care facilities. And I think that's been one of our biggest successes over the last several weeks, is we had just a really, really challenging situation in our long-term care facilities for a multitude of reasons. And we seem to be getting that really under good control. And the numbers have come way down in terms of cases in our long-term care facilities, both in the residents and the staff. So, so far, if that holds, that will be one of our successes.
Yeah, that's wonderful news. And, one of those facilities is located in Montgomery Township, so we're happy to see the improvement there.
Yeah.
Can you give us sort of a preview of what it's like to prepare for these daily press briefings? I mean, this is an incredible amount of information to compile, compose, and present on a daily basis. Tell us a little bit about what that's like.
Yeah. So it is pretty busy. In a good way, though, it really helps us focus our days. And when I say us, I mean the whole team of people that I work with on this. So information comes in the morning from the Pennsylvania Department of Health. We get information from our coroner's office. There's input coming in from all different constituencies, people that need an announcement made, or some change at our community-based testing sites. Like if anyone's looking out the window, we're about to get a really severe thunderstorm. So our testing sites, all of which operate to one degree or another outdoors, will be having to shut down early today. It's just a constant stream of information. And so I get sent at some point in the day a compilation of all the new data about new cases, where those cases came from. I get a report from our correctional facility every day, a report from our coroner's office every day. And then I compile that into what is pretty much at this point a template report. We from the very, very beginning, tried to make our information that we were conveying to the public each day very consistent, so that people would kind of get used to the rhythm of it. They would know when within the briefing particular pieces of information that they might be interested in were presented. We have made very few changes to how we present that information from day one. There have been some important tweaks along the way, but not many of those, and we've explained them when we've done them. So, by and large, I get some very positive feedback about these briefings. They are factual, they are consistent, and they are transparent. And we hope that they've been very helpful for people.
I found them to be very helpful, and I really do feel like you've set the county has set the standard for this type of information sharing, and so I applaud your efforts there. And it's great to be associated with Montgomery County. Moving into the yellow phase, can we talk a little bit about what are some of the biggest differences that our business community and our residents are going to see as they begin moving about the community?
Yeah, so really appropriate question, since that will start to happen on Friday. And I see there's a graphic up, but I'm just going to sort of quickly tick through some of the items. So businesses can reopen. So obviously a number of businesses that were on the governor's list have been open this entire time. But now almost every business, with some exceptions, and I'll get to those in a minute, can reopen. However, this should be thought of as a very soft, very slow, very cautious reopening. We are in no way, shape, or form ready to go back to the way that we were all operating 15 weeks ago. So businesses can reopen, but under the yellow phase, working from home or telework must continue if at all possible. And if that is not possible, then businesses can open with employees in place, but there's pretty significant guidance that should be referred to for how to get your business back open. And I can certainly send people to our website, our montcopa.org/COVID-19. And maybe someone could just type that in the chat box if you wanted, so it's easy to find. There's a bunch of green buttons at the top, and one of them now says guidance. And so we have a very detailed set of guidance documents there, linked there, and we're continuing to update that and enhance that as we get new and better information. Childcare and summer camps will also be able to open in the yellow phase, again following this guidance. You will not be able to visit a long-term care facility or any type of correctional facility, because those places with closed populations are a particular risk of anyone introducing the virus from the outside. Schools are obviously still closed. You can gather now with up to 25 people, but no more than that. And those 25 people must be socially distant. So that has a lot of bearing on any kind of gathering, be it a faith service or any other type of gathering that you wanted to have. No more than 25 people, and you must have the space, if you're indoors, to do that with social distancing. I would offer that anything that you can do outdoors is much safer than anything that is indoors. And we can talk a little bit later if you want about what we've kind of learned about the virus in these 3.5 months and how that informs some of the guidance that I'm sharing with with you. So retail is allowable, but curbside or home delivery is still preferable, but retail can open, again, as long as those social distancing guidelines can be maintained. Now, here's what can't be open. No gyms, no movie theaters or other indoor entertainment, no salons, barbershops, nail salons, spas, casinos, anything along that line. And restaurants and bars can do outdoor dining, and they can do curbside and delivery, but no indoor dining in the yellow phase. So that's an overview of what that looks like.
Okay, and for the consumer, the general public who's going out into the community, what guide?
Tanya, I think I lost you.
Yeah, I think Tanya just got hit by the storm. We just had a big gust blow through.
Oh, no.
I believe Carolyn, are you online? Do you have some of Tanya's follow-up questions?
I do, Rich. So Dr. Arkoosh, we talked a little bit about, the businesses. What would you say for individuals who are going to resume going to those businesses and getting out into the public again?
Yeah, great question. So one of the things I really want to emphasize as we move into the next phase is that the county's taken a number of steps and put a number of things into place to help keep us safe. We have greatly enhanced contact tracing, which means anyone who's test positive, we're calling them and we're tracing their contacts. That's already up and running. We've got plans and procedures in place to help with any hotspots or disease outbreaks to quickly identify that and intervene and hopefully contain that quickly. We've got capacity in our hospitals, which is great. We've got much more testing in the county, and we can talk about some of the details about that later. But here's the thing. All those things are great, but they are going to depend, the success of those things will depend on each person in our county taking individual responsibility and how they behave in our community. So some suggestions that I have. Number one, you should still try to limit your trips, your errand running, your contacts, try to keep it to as much of a minimum as you can. Number two, when you're out, first of all, be patient. I'm not a very patient person, so this has been really hard for me. I'm one of those people like runs in the grocery store, grabs my stuff, gets in the self-checkout line and gets out. Like, you just have to be way more patient than that. So we have to respect the social distancing guidelines. They're extremely important, and we must be wearing masks. So, and let me talk a little bit about that because I know that masks have been somewhat controversial. So if I had one thing I could do over in this whole outbreak, it's I wish we had understood more clearly in the beginning how this virus spreads in the air. So in the early days, and remember, we've only known about this virus since the middle of January, the Center for Disease Control and others who've been studying this did not believe that there was much airborne spread of the virus. Their guidance to us was if somebody coughs or sneezes or is singing, the virus might come out in respiratory droplets, but it would quickly fall to the ground. Well, now we know with a lot more research that the virus can hang out in the air anywhere from 6 minutes to 10, 12 minutes under certain conditions. So that means that you could be exhaling the virus and it actually could impact somebody near you. It could be hanging in the air for those few minutes. The other thing that we didn't know at the beginning and just didn't understand that we now understand in a much deeper way today is that you can be completely without symptoms of this virus, be test positive, and be contagious. So that was another thing we didn't know in the beginning. So all of this informs the new guidance about why we must wear masks. We are wearing masks to protect everyone around us from us. We all have to own the fact that we could be positive for virus, have no symptoms. And, you know, if you're standing next to an elderly person in the grocery store line, like, you could potentially infect them, and they could be at risk for very serious consequences of this disease. And the way I like to think about it, so I don't know how many of you know, but I'm a physician by training. I'm an anesthesiologist, and I don't practice now, but I did practice medicine for about 20 years. And if any of you have ever been in an operating room, and I hope that you haven't, but if you have, all the team in the operating room is wearing a mask. And they're wearing masks. We wore masks to protect the patient from us. We weren't wearing masks to protect us from you, from the patient. We were protecting you from us in case any of us were sick. And that's how we need to be thinking about wearing masks going forward, that it's extremely important that we all wear masks for the protection of everyone around us. Now, if we have a mask on, it does give us some modest protection from others who don't have masks on. But the safest thing is if everybody has a mask on, there's a fair amount of protection there. So I just want to reinforce that, because as we start to relax and more people are going to be out and we'll be in stores and things like that, we need to be patient. We need to observe all the social distancing guidelines, which maybe means you have to stand outside of a store until it's your turn to go in. And we really do need people to be wearing masks.
So you mentioned your medical background, and that kind of dovetails in nicely. And in addition to leading the county in this pandemic, what are your feelings about, are sufficient tests available to support widespread testing?
Yeah. So this has been a very big focus of mine, is making sure that we had adequate testing here in Montgomery County. So we've been very fortunate out of the gate. We were offered federal support for testing. And since probably about the third week of March, we have had United States Health and Human Services support for 250 tests a day here in Montgomery County. So in the first early weeks, all of those tests were at a drive-through site, first in Upper Dublin and now in Whippane at the Montgomery County Community College. And then we started sending some of those tests out. So some are in Norristown and some are in Pottstown, and then the majority at the community college. As of, I think today it's starting, or maybe tomorrow, that 250 is going up to 350 tests. So that's really good news for us. These are no-cost tests. It does not require a doctor's order, and we will test anyone of any age. And as of tomorrow, we're going to open up the criteria so that anyone who needs or wants a test can have one. We are not doing any sort of symptom criteria or anything like that. So if you need a test or want a test, you can come to one of our testing facilities. We are working on a plan to get more geographic distribution of these tests. And I also want to let everybody know that both CVS and Rite Aid are now offering tests at no cost without a doctor's order. You do have to be 18 years or older, but they are increasingly available at a number of CVS and Rite Aid locations around the county. And then, of course, all of our hospitals are doing tests. So it's relatively straightforward to get a test now. These are not the rapid tests. These are the tests that take about a week to come back. Well, if we're lucky, 3 days, sometimes as long as a week, but they're there. So this is another component in my comfort level with being able to go to yellow, is that I do believe that there's enough testing around. And people can find out where those tests are by going to that website I mentioned earlier, montcopa.org/.
It looks like we lost Val.
Yes, it looks like she may have dropped out as well. The storm's been blowing through and it's been pretty bad here. Tanya, do you want to have some comments?
So I can't see anything because we lost power here at our house, which is unusual for us in a storm. Typically here in the township, our house isn't as vulnerable for whatever reason. So It's unfortunate
Can you hear
that.
me?
Oh, she's back.
So my power went out, but I connected to my.
Uh-oh.
Is she there?
Oh, so I'm a little dark.
Oh, that's I'm calling in too, and it's a little dark here as well. I'm gonna just stay connected to my phone. Yeah, so hopefully it's on. I think our testing's in good shape, and the map that shows you where the testing sites are. It sounded like we cut out there. I don't know if the township was affected by the power outage as well. So there was another question that we had about families, across the area. They're kind of mourning this loss, especially anybody who, like many people we know, there are so many families with graduating seniors, and are mourning the loss of the rites of passage associated with high school graduation, trips and proms were canceled. And now that we're moving into the yellow phase, I think that there's probably an inclination to go ahead and host those graduation parties and not deprive their families of this moment of celebration. Can you speak to that? I mean, I know you're experiencing this personally. Yeah, boy, do I understand. I have twins, a boy and a girl, who are high school seniors, and so I do school district superintendents, and their leadership has been so helpful. So as I mentioned earlier, you can have gatherings up to 25 people, but I really just want folks who choose to do that to be extremely cautious in that. If possible, that should be outdoors. And that all relates back to what I mentioned earlier about virus being able to persist in the air. If you can be outdoors, in the sunlight, if there's a breeze, all those things help disperse the virus. And so that's safer than being inside. Everybody has to be in masks, particularly if these are people from outside of your regular household contacts. And need to be socially distant. All other considerations, and there's a lot of sharing dishes, utensils, things like that. A lot of events like this, people are bringing their own beverages, again, so that you don't have somebody pouring beverages and handing a glass to somebody. It's all of those, hand-on-hand things that you really want to try to avoid as much as possible. So it can be done, but it really does need to be thought through and should be done carefully. Our goal here is to not have to go backwards. That is our goal. And we still have, as I mentioned a few minutes ago, today we had 88 new cases in our community. So we still have virus in the community. We are not out of the woods on this. And so people just have to be very cautious, very careful. It's yellow for a reason. And even when we get to green, green does not mean go. Green means a little more relaxed, but green does not mean what it meant, it doesn't mean normal like it was 3 months ago. Thank you, Commissioner. Do we have any questions that have been posed from the public?
Yes, we have quite a few questions, about 10 or so. Do you guys prefer that I read them off to you in the order in which they came in?
That
Yes,
would be
because
great,
we
I think.
can see them.
Yes.
Okay. And just so you guys know, I know we asked for name and address. Only the first question gave their name. Everybody else has marked themselves as anonymous. Is that okay?
Well, yes. I guess with as long as they're appropriate and specific to the topic, I'm comfortable.
Okay. So our first question here is from Lauren Wilson, and she asks, can you talk about the governor's plan to reopen schools that was released? What are the county's thoughts on preparing for wave 2 of COVID in the fall?
Yeah. So unfortunately, I have not had a chance to review the governor's plan in detail. So unfortunately, I'm not prepared to comment on that today, and I apologize for that. It's with the election yesterday and everything else, it's just been a little busy. But I do know that he did release it, and I'm very glad to hear that. And as I mentioned, we've been meeting regularly with the superintendents. One of my top goals is to make sure that our kids can go back to school in the fall. It just has to happen. And so that's another piece of personal responsibility that we all have to take on. We're going to have to learn to live with this virus for the foreseeable future. And the way that we're going to need to be able to do that is in our personal behavior, the behaviors of our business community, and how we all are out in public with events and things like that. If we take all these precautions, I think we'll be able to open school in the fall, but school is very likely to look different. What we've done at the county level, I mentioned that I meet regularly with the superintendents. We now have an individual from our Office of Public Health who is their point person for all the superintendents. So we'll have a consistent county staff member from our Office of Public Health for them to work with. And similarly, on their end, they're putting together an advisory team. So they're going to be working, we're going to be working very closely together on this to make this as safe as possible for our kids. And this is going to be an evolving kind of set of circumstances as we see how the virus is in our community and how we're doing. So lots more to be discussed on that. And I fully intend, and I very much hope that we will be able to get these kids back to school in the fall as safely as possible.
Okay. The next question is anonymous, and they ask, what about youth sports?
Yeah, so youth sports, it's been a little bit confusing. So in the green phase, which hopefully, if all goes well, we'll be there in hopefully, 3 to 4 weeks, hopefully. I'm a little nervous about Memorial Day weekend and, some other things, but we'll see where our numbers are at. Youth sports can, at least the non-contact ones, start back up in green. And in yellow, they are allowed to operate within summer camps and things like that. So I've received a lot of questions about baseball in particular, which hopefully we'll be able to get that going, certainly by the green phase. And I've been in some conversations with the Department of Health about that sport in particular in the yellow phase, but I don't have a clear answer on that yet. But other contact sports, particularly for this fall, like football being the obvious one, we'll just have to see where we're at this fall, what the numbers are looking like, and the disease trajectory. Basketball is going to be very tricky because it's such close contact. I think that we're now at a place where tennis can be safely played, particularly if people bring their own balls and only handle their own balls. There's a whole bunch of USTA tennis guidelines around that. Obviously, people are playing golf and things like that. So, I think we can slowly and carefully start to resume some of these things. I don't know, and I forgot to answer this earlier, I don't know if we're going to necessarily have a second wave in the fall. That's not clear to me yet. We may just have this go, kind of continuously. And it's not clear to me if the cases will tick up in the fall, or if we're able to keep a good job with our social distancing and all these other practices, just keep it at a steady state. That would obviously be our goal. What will happen in the fall is the flu. That's when we'll see the flu come back. This virus is not the flu virus. It's the common cold virus family. And people get colds all summer. People are going to get coronavirus all summer. So it's not going to behave like the flu where it goes away in the summer and comes back in the winter. This is going to be with us continuously. What people are worried about in the fall when flu season starts is what that will do to hospital capacity, because every year many people choose not to be vaccinated for the flu, and the vaccines are never perfect. And so we will see hospitalizations from the flu in the fall. And then, on top of that, if we have COVID hospitalizations, then that could create some capacity issues in the hospital, which is why it's all the more important that we do our best to keep this thing contained from here on out. The hope being that we'll avoid a second wave.
Okay. The next question is from Carol, and Carol asks, we've been visiting my grandson while social distancing, but at what point will it be safe to visit and actually hold him?
Yeah, I know, Carol, that's so hard. I just feel for parents and grandparents and everybody through this whole thing. So, I think as we move into this yellow phase, some of the answers to those questions really depend on what you've been doing and then what your other family members have been doing, and sort of what their potential for exposure is. So if you've been, pretty isolated and haven't just been doing essential errands, and so has the other family members that you've been visiting, one option would be to just get everybody tested, at least get all the adults tested, and then you'll have a sense of where you're at as a family. That would be a relatively straightforward thing to do, and we have the testing capacity to do that now. Just the one thing to be considerate of is if someone in your family that you're visiting, if one of those individuals has a job, like they're a hospital worker or a grocery store worker or something like that, where they are at, some decent risk of being exposed in their job, I would recommend that you definitely get tested before you take that next step of a lot of physical contact. So it's really kind of that risk assessment of what's their likelihood of having the virus versus your likelihood of having the virus. And but at this point, if you wanted to get tested, you certainly could.
Okay, thank you. The next question is anonymous, and they say, is it safe for political campaigns to resume door-to-door activities in the yellow phase, or should they wait until we move into the green phase?
I would say move until we get into the green phase, because what the green phase will mean is that our numbers of new cases are down a little bit lower. They're never going to be zero, but down a little bit lower. And again, the good news is when you're knocking on a door, I've certainly done that many, many times. One of you is outside, the person knocking is outside. And I think what everyone's going to have to be really mindful of, though, is that the person knocking will have a mask on. The person answering the door probably does not. So you really will have to keep, a minimum of 6 feet distant. Honestly, you should probably be a little further apart if one of you doesn't have a mask on. Second, no shaking hands. And third, no handing of literature. So typically, as a candidate, if you knock on a door, you introduce yourself, you give your spiel, and then you leave behind some piece of literature about your campaign. That can't happen. We just cannot have people handing people literature. That's just something we shouldn't be doing. So, with those caveats in the green phase, I think it would be fine. But really in the yellow phase, we still have a decent number of community cases, and we want to get that number down a little bit lower before we start saying, we can ease up on some of these things.
Okay. The next question is also anonymous, and it's another question about youth sports. So they say, can we get some clarification about allowing youth sports? I'm on the board for a baseball and softball league and would like to be able to tell parents when their kids can get back to some activities. Kids can play sports in summer camps in groups in yellow. Are we allowed to play baseball and softball outside of summer camps?
So I mentioned that earlier. That's where I'm trying to get that clarity that the summer camps are allowing it. And I'm trying to get clarity from the Pennsylvania Department of Health on other youth sports like baseball. So as soon as I can get some clarity on that, I will certainly mention that and make that public. I know it's been really frustrating for folks. In the green phase, you will be able to do it, but the yellow phase, it's just not clear yet.
Okay. The next question is also anonymous, and they say, the CDC is recommending all people to wear a mask when together in case you are positive but asymptomatic. But the World Health Organization still today says on their website, healthy people should only mask when caring for a positive person. Can you explain why the different recommendations from the two organizations?
So I don't know why the WHO is making that recommendation. I'm sorry, I don't have insight into their decision-making process. I will say that the CDC guidelines are based on what we're seeing here in the United States. And I gave a big, long explanation about the importance of masks a few minutes ago. Hopefully the questioner was on and heard all that. But the experience here in the United States is, just to briefly summarize, that we have a lot of asymptomatic people who are contagious and don't have any idea. I'm not being, it's not a criticism to them. They literally have no symptoms. And that seems to be a much bigger component of spread here in the United States than we appreciated in the beginning. And two, that there's been some good research done that shows that the virus does linger in the air, which was also something we didn't understand at the beginning. And so for those reasons, the CDC here in the United States is recommending that everybody have masks on when you're outside of your home, your normal household contacts. And so I would urge you to please follow the CDC guidance on this.
Okay. The next question is anonymous, and they ask, from a government perspective, is there any thought to offering testing periodically to essential government workers such as police, fire, and wastewater workers?
Mm-hmm. Yeah, we do that already, actually. We've been working with our 50 municipal police departments in the county, all the fire departments, all the utility companies, because they are very essential workers. We've been working with them continuously. And whenever there's a request to run their folks through one of our testing sites for whatever reason, we immediately accommodate that request and prioritize those folks getting appointments. So we've been doing that from the minute our testing site was open, and we fully intend to continue to do that. That's been a very important part of making sure that our critical workforce is safe.
The next question is anonymous, and they ask, do we need appointments to get tests?
Yes. So at all three of our testing sites, the drive-through testing site, you absolutely have to have an appointment. And you can make that online at montcopa.org/COVID-19 by clicking on the county testing information button. And there's a form there you can fill out. And for the drive-through site, you can also call 610-631-3000. Now, in both of those cases, that opens up at 8 a.m. The online form as well as the phone number opens up at 8 a.m. for appointments that day. At our Pottstown site and our Norristown site, we prefer that you make appointments. Those appointments open up at 8:30 in the morning for that day, and each of those has a phone number. We don't have online appointments for those two sites, and those phone numbers are on our testing site that I mentioned to you earlier. And let me see if I can quickly get you those numbers. I can get that information to Tanya. I don't have those numbers memorized as I do the other one. But again, if you can go online and just click on the county testing information button. Oh, look, it's happening right in front of my very eyes. So go down to, I think, register for a test. But you see the county testing information button. Click on that. And then underneath that, it says register for a test. So that'll get you to our site in Whippane. And you can see like all the, they actually had to close because of this storm, but That's where you go to do it. And it's very easy to do. Pottstown and Norristown, you can walk up without an appointment, and they will accommodate you if they can. But it's always better to have an appointment. We have a set number of tests that we can send to the lab every day. So we have to make sure across the county at our county testing sites that we don't do more than, now it's 350 tests in one day, because if we do 351, one of those tests doesn't get sent to the lab until the next day. So, and that's just not a best practice. So if you can make an appointment, that would be great.
The next question is anonymous, and they ask, I've heard of the tests producing false negatives, but are false positives as well. How accurate are these tests?
Yeah, so really, really good question. So there's a couple different kinds of tests. There is the test for the virus that involves a nasal swab or a nasopharyngeal swab, which means it goes kind of pretty far back and is a little bit uncomfortable. At our testing sites, we're doing the nasal swab that the individual does themselves. So you put it in your nose on one side for 15 seconds, and then you put it on the other side for 15 seconds, and then you put it into a little test tube and it goes off. So those tests take a couple days to run, and those tests are the most accurate tests that we have. There are about 3 to 5% false negatives. So meaning that out of 100 tests, there might be 3 to 5 tests that come back negative when in fact the person does have the coronavirus. There are very few, almost no false positives with the test. I never want to say there's zero because, you know, if like the test tube got contaminated in some way or something like that, you can have a false positive, but those are very, very rare. Now, with the rapid tests, there are definitely more false negatives with the rapid tests. And those are tests that can give you a result in 10, 15 minutes. And the FDA is still working with the companies, several of these companies that make these rapid tests. My hope is that by the fall, these rapid tests will be much more accurate, and they can actually be used to, for instance, check all the kids in a classroom or check kids as they go back to their college campus with a rapid test that would give you a result right away. And then that would help then inform strategies to say like, okay, we know all these kids tested negative for the virus today, etc. So I'm hoping that the rapid tests improve and are much more widely available and less expensive by the fall. That will make the whole going back to school conversation 100% easier than it is today. But the rapid test, not as reliable on the false negatives or the false positives, but the virus test that we're doing at all of our county testing sites, there are almost no false positives. There are some false negatives. I hope that helps. It's a lot of wonky testing info.
So the next question is from PAR, P-A-R, and they ask, are any guidelines going to be given to business offices for having employees back on site?
Yeah, there's actually quite a bit of guidance available. And again, if you want to go to that website that I mentioned, the montcopa.org/COVID-19, click on the button at the top that says guidance, and you will see a whole list of different kinds of guidance. There's a whole set for businesses. One really important thing I want to mention that I haven't mentioned yet is that if you've been out of your workplace, out of your building for all of these weeks, it's really important that you flush your water systems and your, like if you're heating and air conditioning systems, use certain types of water that water flushes through. This is how you can get things like Legionnaire's disease and stuff like that when pipes have been sitting with water in them for long periods of time. So if you have any questions about that, there's guidance online. You can also call if you're for instance with Aqua or any of those other places. They all have published guidance that should be easy to find about how to safely open back up your buildings. But in the yellow phase, as I mentioned earlier, The preference is to continue telework if that's possible for your business. But if it is not possible, you are allowed to bring employees back to work as long as you can meet all the social distancing and other stipulations that are in the governor's and the Pennsylvania Department of Health guidance. And that's all linked from that spot that I told you about.
The next question is from Sean O. from North Wales. Is there a map to track the rough locations of identified positives in the county?
So we've had a map up from the first day that shows the municipal, it's the municipal map, and it shows how many cases are in each municipality. We have that as a map. We have that also in chart form with additional information about the age range and the gender and things like that. If you haven't been to our COVID-19 website, it is a treasure trove of information. We have a map that shows the location of the deaths, but we don't get any smaller than the municipality because obviously there are confidentiality issues here. And so we don't go any more detailed than the municipality in terms of our public maps. I will tell you, though, that my Office of Public Health is doing things, and it's particularly now that we're moving into yellow, we're really ramping this up. We are putting together data systems that will allow us to see if there is a hotspot of disease that's bubbling up. So maybe
Did we lose Val?
Hey, Doctor, could you unmute your mic? Sorry about that.
There we go. So I don't know how that happened. Where did you last hear me?
Data systems that were being put in place.
Okay, great. So not too much. So we're putting data systems into place that will help us at the county and in our Office of Public Health quickly identify if there is an outbreak in a, say, like in an apartment complex or within a, a several block area in a neighborhood. And then we will do everything we can to investigate and see if we can offer any assistance or guidance, depending upon what the situation is, to try to get that outbreak under control. And that's all part of how we keep from going back into red and get to green as quickly as possible. And then once we're in green, stay in green, because the virus isn't going away. It's going to be with us all summer. It's going to be with us for the foreseeable future until we have a vaccine. And so our goal is going to be figuring out how to live with this thing as safely as possible.
The next question is from David Cohen of Elkins Park, PA. Dr. Arkoosh, your statement of green does not mean go is well taken. How will the county get this message out, as when many people will think that when the county reaches the green stage, that it will be a return to normal?
Yeah, thanks, David. Good to hear from you. Events like this, as I mentioned, we not only do we have a weekly call with the school superintendents, I have a weekly call with the faith community, and we get about 120 to 130 faith leaders on that call every single week. So we're sharing all of this information with them. We have our director of our Commerce Department has a weekly call with all of the county chambers of commerce, of which there are now, I think, 14 or 15. I keep losing count because they keep creating them. So we do our press briefings. We are going to start doing our press briefings 3 days a week now. And so, but at every briefing, we emphasize this. And we've had, really consistent press. The Inquirer writes about us every day, and our local newspapers, the ones that still exist, have been writing about this every single day. So, social media, our website, every avenue we have, we will be preaching this message that green is not go. Green is a little bit faster yellow. But everyone must continue to do their part to keep this virus under control. There's not going to be any summer vacation with this virus. It will be with us all summer. I think that's actually one of the biggest misconceptions. So, anything that any of you that are listening can do to help spread that word will be very, very useful.
The next question is from Trina Anslow. I'm going to have surgery next month. I have been told I need to be tested for COVID. Is this now going to be common practice for surgery?
Yes, it is. So the hospitals, I believe all of them now, do have a protocol for pre-op testing for the COVID virus. And you should get that test done wherever you're having your surgery, either at the hospital itself, or if you're having outpatient surgery, you should have that test done at an affiliate of that hospital, so that the doctors who are doing your surgery can see the results of that test within their system. That would be the one thing, like, I would ask you not to come to the county's testing site for that particular reason, because we don't have a good way to get the results to the hospitals. So the reason the hospital is asking you for that is that the people that will be taking care of you, they want to know whether or not they need to be in full personal protective equipment if you're positive for the virus. And if your surgery is totally not urgent, or as we would say, elective, they might even want to put that surgery off until you were virus free, because obviously that has a big impact on anyone taking care of you in the hospital. And personal protective equipment, while it is more available than it used to be, it by no means is it abundant. And so our hospital staff are trying to be as careful as they can with the use of personal protective equipment, use it when they need it, but if they don't need it, not use it. And so that's part of why they're asking you to be tested. It's for everybody's safety.
The next is anonymous. It's not a question. I suppose it's just a comment they're wondering if you can speak to. So the comment is, it's frustrating because it sounds like some programs are using summer camp as a way to begin their youth sport program, which typically wouldn't be able to start until green.
I don't have any specific information on that, so I'm not sure exactly how to address that. All I can tell you is just sort of to restate the facts, which are that summer camps are allowed to let their campers play sports. I'm trying to get the clarity, particularly around baseball, on whether or not youth baseball, separate from a camp, is able to start back up.
Okay, the next question is from Sue. Do you anticipate a spike in COVID because of these large groups of protesters? Perhaps we may go back to red.
So I'm concerned about Memorial Day. That was my first concern, and how some of the things that went on that weekend. And if Memorial Day is a problem, then we'll be starting to see that towards the end of this week into next week. The way that this virus spreads and the time that it takes to show symptoms, it's usually 2 to 3 weeks from an event that you see the repercussions of that event. So first I was worried about Memorial Day. And yes, I am concerned about the large gatherings that we saw over the weekend and continue to see in some areas of the county. So in some instances, everyone's had masks on, which is great. And I know they've been trying to maintain social distance, but I am worried, and I hope that we don't see a big spike from that. Would it be enough to make us go back to red? I certainly don't think so, but because we have all of these protections in place now to try to prevent that, I would be more worried if we saw large gatherings of people all over the county every single day of the week type thing, where multiple people are being exposed. That would be something I'd be more worried about. But sort of these discrete events, I'm hopeful that if they do lead to spread, that we've got the infrastructure in place to identify and contain them. But the more there are, we do have to be mindful of it.
Okay. The next question is anonymous. Are there locations that we can get antibody testing to see if we were previously infected and therefore could possibly donate plasma if needed?
Yeah. So there are some of our hospitals that are doing antibody testing. So if you do have a regular healthcare provider, I would check with them and see if they are affiliated with a hospital system that's doing the antibody testing. And that's so kind of you to offer to donate plasma. That's really great. So the county, we are not offering the antibody testing right now because, again, that is a look in the rearview mirror. We're trying to help people figure out if they have virus right now so that they can, make plans accordingly. The one cautionary note about the antibody testing is that you need to get it done in a place that is using a valid test. There was a very quick process that the Food and Drug Administration used to validate a lot of these antibody tests, and it turned out to be a little too quick, and it turned out that a lot of the antibody tests really weren't reliable. But the hospitals are using, I think, pretty decent tests at this point, so that would be where you want to go. The other cautionary note is that just because you have antibodies, it remains unclear how much you have from the coronavirus, this particular strain of the coronavirus. So if you do have antibodies, don't think that you've got great protection. We hope that you have immunity for a few weeks or maybe a couple of months, but the jury is still out on that. And we're looking again to other countries that are ahead of us on this. It's not really clear that people have a lot of long-lasting immunity. So please, if you are antibody positive, don't think that that means that you can just, go out and run free. I would assume that you might still be at some, probably reduced, but still at some risk.
Okay. There are 3 questions left. The next question is anonymous. We keep reading about new positives. However, are these positives from people who have been regularly exposed to community during shelter at home? It's confusing why such high numbers of positives if we have been sheltered at home.
Yeah, that's a good question. So every day when we announce our numbers on our website, we'll tell you, we break out for that day if there's any cases from long-term care facilities and if there's any cases from our Montgomery County Correctional Facility. So those cases are broken out, and then you can do the math and know how many are from the community. So for instance, for the cases that I'll be announcing today, we've got 97 new cases. 9 of them are from a long-term care facility, so 88 are from the community. And so people who have been really following the guidelines ask me all the time, how is that happening? And I will tell you, it's because not everybody's been following the guidelines. And so, this is one of my great frustrations and why I keep preaching about personal responsibility. I can only do so much. I can put all this infrastructure in place. We've got a great public health team. We've got all these pieces in place, but people, the residents of this county, have to decide that they're going to be part of the solution and not part of the problem. So for instance, those 88 cases that we're seeing in the community today, wouldn't surprise me if that is starting to bubble up from Memorial Day weekend, where people were not at events, where they weren't very socially distant, where they weren't wearing masks. There is still, unfortunately, a lot of resistance to wearing masks right now. That's where it's coming from. People stores that don't have good social distancing set up, things like that. I really urge people to vote with your pocketbooks. And if you walk into a store that seems to be flouting the regulations, I would just turn around and take your business elsewhere. Like, they're hurting our whole community. We are all in this together. And if we don't work together as a community, there is nothing that is going to keep us safe until we have a vaccine. So I will give you one piece of good news. There was a lot of concern yesterday about voting, and we legally could not prevent somebody from voting because they didn't have a mask on. And I am happy to tell you that I'm not aware of a single person that showed up to vote in person yesterday that didn't have on a mask. And so, kudos to everybody. You protected our poll workers who were quite nervous about working yesterday, but they came to work anyway because they knew it was their civic responsibility to make sure that people could vote. So I just want to give you good news too, right? Like everybody that voted in person yesterday really stepped up and did the right thing. And I'm hoping that that's the beginning of everyone in this county. You know, even if you personally think you don't need to wear a mask, I'm just asking you to please, please wear one anyway, because none of us know. None of us know if we're positive and potentially infectious to somebody else.
The next question is anonymous. When social distancing stay at home was first mandated, it was to flatten the curve, so the hospital system was not overwhelmed. We did that. The hospital system was not overwhelmed. It seems like the goalpost continues to be moved. Can you speak to that?
So kudos to everyone. We did not overwhelm our hospital system. We got very, very close. We did have a little bit of overflow into some surge capacity that we created, but that was brief and only for a few days. So that was great. Right now, we still have in our hospitals around 100 and I think about 80 people or 90 people today still hospitalized in our county, and about a third of them are on ventilators. So those are people that are quite sick. So it hasn't gone away. I'm not sure what the goalpost moving is. We still have virus in our midst. As I just said, we had 88 new cases from the community today. So now what we have to do is keep the curve flat. We have to reopen responsibly, and we have to keep the curve flat. And the way that we do that is with all the social distancing measures. If anyone thinks that we can just go back to the way we were 3 months ago, then it's guaranteed that we'll be right back up with another huge spike of cases that will put our hospitals at risk. So now we're in the phase of living with the virus, and we will have to live with this virus for the foreseeable future. And it's going to be months, maybe even longer, until we have a vaccine or we have a treatment that's actually effective. We have treatments that help a little, but we don't have a treatment that is consistently effective for this virus. And so till we get to those places, we are all going to have to be careful and learn to live in a little bit different way to protect our whole community.
Thank you. Kelsey, I'm going to jump in.
I'm so sorry, but I do have to hop off. It's a little bit after 1 now.
Sure.
Oh, yeah, we'll just close. Thank you so much for joining us today, Dr. Arkoosh. We can't tell you how much we appreciate this update and the very detailed information you were able to provide for our community. Thank you again. I know how busy your schedule is, and for you to take the time out of your very busy schedule today to join us is greatly appreciated. So thank you.
Thank you, and I really appreciate all the questions, and I know this has been just an incredibly difficult spring, a spring none of us could have imagined, with businesses closed and events canceled and postponed, and I just want to thank all of you. The reason that we are going to be in yellow on Friday is because of all the sacrifices that people made across this county, and I am grateful to you for that, and I'm just going to have to continue to ask you to keep it up. We're not done or over or anything like that. But I think we can have, take some really positive steps here, get our county back to work and get our kids back to school in the fall. If we work together and we work smartly and we don't take any unnecessary risks, I firmly believe that we can get that done. So thanks everybody. It was a real pleasure, and take care. Stay safe.
Thank you.
Okay.
So just to close, I want to let everyone know, if you had an opportunity to watch this, or if you didn't, we're going to be posting this video on our website, and so you can look for a link to that. We'll also be sharing that link on all of our social channels as well, in case you didn't have an opportunity to participate. Thanks again to Dr. Arkoosh and for everyone who tuned in to watch today.